Good afternoon, and thank you for joining us for this last Legal Epi at Lunch webinar for 2025. I'm Bethany Saxon, the Director of Communications here at the Center for Public Health Law Research. I will share a few housekeeping notes before we begin. There we go. First, this webinar is being recorded. The recording will be added to our website, phlr.temple.edu, and to YouTube, and it will be distributed via email using the email address you used at registration. Please make use of the Q&A box throughout the presentations. If you have any questions or comments to contribute, we will address those at the end of the presentations. Our agenda today will run through many facets of the field building work that we're engaging in here at the center and elsewhere. You will hear first from our leaders, Scott Burris and Rakaya Yerby, about how we're thinking about legal measurement in the context of social and structural factors of health. We'll then hear from Case and Schmidt about some work to respond to ongoing transparency crisis in legal measurement. Alex Hess will then share a summary of some recent efforts to engage practitioners and understand their needs for using legal epi in policymaking and public health practice. Finally, we'll hear from Ellen Breckenridge, who has been working on integrating legal epidemiology into curricula at her institution and beyond. With that, it's my pleasure to introduce Scott Burris, the Director of the Center for Public Health Law Research. Scott? I think you may be muted.
Here we go. Yeah, somehow my phone did not want to let me talk. Let's hope it wasn't wrong, that it was wrong, I should say. So welcome, everybody. Delighted to be here on the last webinar of the year. I'm going to say a few things about Legal Epi and some of the current issues, and then move on to the rest of the performance. So if you've tuned in, you're interested in Legal Epi, as we define it here on this slide, a scientific study of the health effects of laws and legal practices. But why legal epidemiology? Well, first and foremost, it's because law matters. Law is one of the most important things we do as a society to create safe conditions and encourage healthy behaviors. And you can also think of it as a treatment, but a treatment that, unlike your average pharmaceutical, we give to tens or hundreds of millions of people at a time. So obviously, it's really important to know who's getting that treatment, what effects that treatment is having, and whether it's having bad side effects. In that kind of work, measurement of law is the first step. If we don't have an accurate measurement of the legal exposure, then no matter what else we do, no matter how elegant it might be in scientific terms, is going to be doomed to, well, being likely quite wrong. Now, legal measurement has been around for a long time, and we've been taking what you might call baby steps for almost a century. I always show this 1941 paper as the first published legal mapping paper, as it were, that I can find, 50-state survey in public health. Over the years after that, we got bigger and more attractive charts, but we were still very much in the days of trying to summarize legal information, mostly in text or in static tables like this, and mostly applying what we used to call traditional legal research methods, which were highly accurate by and large, but were not very transparent. Scientific legal mapping, which involves the transformation of the text of law into structured data, really emerged in about the turn of the century with the Alcohol Policy Information System, which aimed to create a detailed, transparent, and highly scientifically credible mapping of a wide variety of alcohol-related regulatory provisions in the states, and to make those data publicly available, free, in a very early and important example of open science. Since then, we have seen some of the advantages of scientific legal mapping. The fact that we can build much more complicated data sets in the manner of APIS, uh, and that we can then start to compare how different states are handling particular policy issues. We've been able to broaden out from alcohol, so that from the early work using APIS data, we then had the development at the National Cancer Institute of what they call the CLASS system, which was a highly robust rating system for um, laws related to school students and their health. We developed Law Atlas after 2010 at the Center for Public Health Law Research as a repository for our and other people's open source legal data. And all that has produced really hundreds and hundreds of rigorous legal epi studies. But there is a storm brewing in legal epi, and it's a storm that is rooted very much in the problem of measurement. So today we're going to be talking a lot about better legal measurement, why it's needed, and how to promote it in the training we do with our students, and in the help that we provide our colleagues. So that's all I have to say. But before I turn it over to the speakers, I want to take this opportunity for a sort of center commercial. This is the first opportunity I've had to be on the same webinar with Professor Rakaya Yerby, who joined the faculty at Temple Law School last summer and who is joining us as key faculty at the Center for Public Health Law Research. She's had a rather interesting and illustrious career and already been at some of the best health law centers in the country. So we were particularly happy to get her to come to ours. And in honor, as it were, or maybe as a penalty for joining us, she's going to be the moderator for the rest of today's session. And so with both pride and pleasure, I introduce to our CPHLR broadcast audience, Professor Rakaya Yerby.
Thank you for that great introduction. And I just want to speak a little bit about my background and then talk briefly about some of the work that I think we can do to further strengthen legal epi. So if you note on the slide, I have a JD from Georgetown University, a Master's of Public Health from Hopkins. I actually worked in the General Counsel's office for the U.S. Department of Health and Human Services, and bring to the center over $5 million in grants. I've had over $5 million in grants from Robert Wood Johnson Foundation and the National Institutes of Health. I, for a period of years, worked and co-taught with the Centers for Disease Control and Prevention, where we trained law students to do policy surveillance and beginning to understand legal epi research. And one of the projects that I did with my students when I was at St. Louis University was a wage pass-through project. And you can see here what we found. We were asked by a group in Maryland to study wage pass-through laws, which are laws that adopt additional pay for nursing home workers and community health workers and home-based workers to try to lessen those workers from leaving. And we were able to put together this report, which has been used by the federal government, researchers, state governments. And so really key to be able to train law students and students to be able to do this work, which is so important for policy and changes that can improve people's lives. So I just want to talk a little bit about strengthening legal epi. right? And when I think about that, I think about incorporating measures from social epidemiology, right? Social epidemiology is the study of the effects of social and structural factors on states of health. Traditionally, they look at income, race, and other factors. And what law does is it begins to look at this impact that law can have on these social factors. What we do see is that law could be both a tool for negative practices and both also a way to address those. And so, as you'll see on the next slide, one of the things that I have written is an article about structural racism and health disparities, where I highlight that law can be a tool and has been a tool, unfortunately, for structuring systems in a racially discriminatory way. We see that currently. Historically, we saw that during the Jim Crow era, where the government used law to structure the employment system in a manner that benefited whites, providing union benefits, providing protections on minimum wage. And those continue sometimes to be in place, particularly for home health care workers. On the next slide, what you can see is that it's not just law being used as a tool for racism, but as noted when social epi, it could have impacts on income through classist laws, sexist, ableist laws, right? The laws that are on the books that allow employers to pay individuals with disabilities less than a minimum wage, even though they're doing the same job. So one of the ways I see that we can further strengthen legal epi is beginning to understand and to track the ways that law could be a facilitator of good health, but also a barrier to good health. So in my final slide, I just want to say I'm so excited to join the center and to serve as moderator for this panel. And I look forward to hearing the speakers' presentations and then being able to answer some of your questions. Thank you so much.
Thanks, Rakaya. Next, we're going to hear from Kason Schmidt, who's an associate professor at Texas A&M University School of Public Health.
Thank you. Can you go to my first slide? Yeah. So when we're talking about legal epidemiology, fundamentally, we're talking about the use of scientific methods to evaluate the impact of law on population health. And a necessary input of legal epidemiology, as Scott laid out, is some empirical process to measure laws, measure features of laws, so that those features can be used as some exposure variable in our scientific study. Now, when I say that we need to measure law, I'm talking about a process that takes legal text and from that legal text creates some structured data that can be used in an analysis. And that process in of itself has steps. And what we know is that how we do those steps really matters. And if how we do those steps matters, then we really need to disclose what it is that we did so that others can evaluate the validity and reliability of our work. Next slide, please. Now, unfortunately, we know from a 2024 review by Dawn Pepin and her colleagues that we are not doing a really good job of reporting what it is that we did. Pepin and her colleagues reviewed 177 studies assessing the impact of law on health outcomes using 10 or more jurisdictions, and this was between 2009 and 2019. And they found that many of the studies suffer from a critical lack of transparency in how legal variables are defined, identified, and measured. This, of course, is problematic because transparency is needed to fully assess the validity and reliability of a study. And without that transparency, you simply can't do that assessment. Another interesting finding from the Pepin study is that this type of research is being done by researchers from many different academic disciplines. And this finding is both highlights the broad interest in legal epidemiology and whether or not researchers are using that term or not. But it also communicates the immense scope of the current transparency crisis. So let's, with this chart right here, take a closer look at some of those Pepin findings. What you see here is a pie chart displaying the source of the legal data used in the studies included in that Pepin review. And starting from the top red slice of this pie, we see that about 8% of studies provided no information whatsoever on where they got their legal data. Now, remember, this is the exposure variable that they're using in their studies. So we're talking, almost 10% of all studies in that review provided zero transparency on, the half of the data that they need to do their actually scientific analysis. So as we move around the pie chart, looking at that blue segment, we're showing, more or less about 35–40% of studies that are at least partially using some of their own legal mapping. They're either entirely doing their own legal mapping or they're taking some external data and doing something else on top of it. We also see that with that orange slice, that just over 50% of all studies are relying entirely on legal data from some external source. But, next slide. When we dig a little bit deeper, the scope of the problem gets more concerning. So from the Pepin review, we know that only a small proportion of those studies that are actually doing some original legal mapping are disclosing their search string. To disclose how they're finding the relevant laws or legal text that they're including in their studies. Now, for those of us that have done legal mapping studies, we know how fundamentally important our search methodology is to the validity of our data collection. And without disclosing the search string, it's really difficult for us to understand how valid that data collection of those studies actually was. So with just a minimal amount of extra digging, all of a sudden, we've significantly expanded the slice of this pie representing gaps in scientific transparency. Can you advance? Right. So we haven't even begun to explore the largest slice of this pie, representing the external sources that many studies are relying on. What we do know from the Pepin studies is that many of these external sources, actually about 40% of all of the studies in the Pepin review, are from websites. And while Pepin and her colleagues did not dig into those external sources, I think both intuitively and from experience, we know that websites can vary considerably in terms of their quality. So I know Scott and his team at Temple University have begun to dig in many of these external sources, and I can't talk about the results here, but I feel confident enough to say that this isn't a question of whether or not there is a skeleton in the closet, but it's a question of how many skeletons we are going to find. So next slide. So in response to these concerns, the Legal Measurement Methods Consortium was formed in the summer of 2024. This is an international and interdisciplinary group that was brought together through great effort by Scott and his team at the Center for Public Health Law Research. The consortium met and looked at this evidence from the Pepin review, and we came to two conclusions. First is that there is a problem. And second, that a formal reporting standard would help improve transparency. So one of the first steps that the consortium did was to put forward a call for formal reporting standards for legal research in public health studies. And that this formal call is now in print in the American Journal of Public Health. Next slide, please. So how do we go about creating this formal reporting standard? Well, there's an organization, an international initiative called the Equator Network that is dedicated to improving transparency in scientific research. And they have an established process for developing, disseminating, and implementing reporting guidelines. Now, I expect that many of you on this webinar might not be familiar with the Equator Network, but I'm fairly certain that many of you are familiar with some of their work. So for instance, we've got the PRISMA reporting standard for systematic reviews. We've got the Consort standard for randomized controlled trials. These are highly influential reporting guidelines that were developed through this equator process that have been really helpful to guide researchers across disciplines to better describe these types of studies in their scientific publications. Next slide, please. One of the initial steps in this equator process is to pre-register a standard that is currently under development. And this allows for an invitation for greater participation and hopefully a broader consensus in the development of those standards. I'm happy to say that the Legal Measurement Methods Consortium has now registered STELLAR, the standards for legal epidemiology reporting, as a standard under development. And we extend our invitation to you to join or support this process and our eventual dissemination of the standards. Next slide, please. Now, to be clear here, our goal is not to prescribe or even require that researchers follow certain methods in this type of research. Instead, our goal here is to identify the minimum elements that should be reported in legal measurement studies. Next slide. Okay, so there are lots of benefits for going down the process to developing formal reporting standards. Perhaps most obviously, reporting guidelines will help researchers, yes, thank you, describe what it is that they did. And as a result, the reports from the research will be much more complete and hopefully more transparent. Next bullet, please. We know that there are a lot of researchers who are looking for legal data out there in the wild, and a reporting guideline will help them help give them the tools to be better critical consumers of data, to better evaluate whether or not this data set that they find on some random website is appropriate or even valid for their intended use in their scientific study. We know that there are a lot of researchers across disciplines that are doing legal epidemiology. You can go ahead and advance the next bullet. Thank you. Maybe they're not using that language, but doing legal epidemiology regardless. Having a reporting standard is going to start to develop some level of consistency in how that work is described across disciplines. It's going to allow for better learning and better communication across between these academics with very different backgrounds. Next bullet, please. We also know that an important tenet of science is describing your work with sufficient details so that others can follow your process and hopefully come to a similar result. That's replication. And we know right now, as a field, that we're not doing enough so that others can replicate every study. So a reporting guideline is going to help get us closer to that. Next bullet, please. So a reporting standard also gives peer reviewers and journal editors new tools to better understand how a given report either aligns or departs from methodological conventions. And the idea is not just to allow for more effective gatekeeping, but also to allow for more effective and helpful feedback from both peer reviewers and journal editors. And for the last bullet, please. A point I really want to emphasize and in this slide with, I would strongly argue that a reporting standard is actually going to help methodological innovation. If I'm doing innovative work, but I'm not reporting what it is that I'm doing, then my innovation just stops with me. But if I'm reporting what I'm doing and how it's innovative, then others can learn from my innovation and adopt it themselves, or, even better, further that innovation across the field. But this can't be done without reporting. I would argue that this is even more critical in the current era, where we're starting to see new tools like artificial intelligence, large language models, being looked at for application in scientific legal measurement. Reporting becomes even more important here because we need to understand what's working, not working, and what might work better. And that just can't be done unless we're adequately reporting what it is that we're doing and how we're doing it. Next slide, please. I want to end this talk with a brief call to action. The point I'm trying to make broadly is that when scientific findings lack transparency in that process, that science itself is compromised, even if the methods that were used are sound. If we as a field are going to maintain credibility in our push for evidence-based policies doing public health, there's just no way around it. We've got to course correct the field now. We argue that the development of a reporting standard, we're calling it stellar, it is an essential first step in that process. So I'd like to extend an invitation to you and the audience and the broader public health research community to engage with us in this process, either in participating in the development of the standard or in the eventual dissemination and adoption of the standard, that by being champions of it in your own work and when you peer review others. So my contact information, here's a URL to the Legal Measurement Methods Consortium. Can give you more information on that. Thank you so much. It's been a delight to talk with you all today.
Thank you so much, Kason. We'll drop the URL also in the chat for folks as well. Next up is Alex Hess, who's our legal training manager here at the Center for Public Health Law Research. Alex, you can go ahead.
Thanks, Bethany. Hi, everyone. My name is Alex Hess. I use she, her pronouns, and I'm the legal training manager at the center. And I'm excited to share with you all the work that we've been doing in partnership with Temple's Barnett College of Public Health through funding from a CDC cooperative agreement to promote capacity building within state, territorial, tribal, and local health departments to do legal epi. And while this work is focused on capacity building within health departments, I think it will be widely applicable and useful for folks who aren't at health departments or who are working with health departments. Next slide, please. So our mission with this effort is to support health departments in building capacity to do legal epi, which is rooted in the 5 essential public health law services, and more on that in just a moment. But to do this capacity building, we're working on a few things, one of those being facilitating the development of a community of practice so that we can make this effort innovative, but also collaborative and sustainable, where members can share resources and learn from each other to explore how legal epi can be a more accessible tool in promoting and carrying out effective policies that promote health. Next slide, please. So I mentioned the 5 essential public health law services, which some of you may or may not have heard of. And these, I think, have a lot of parallels to the 10 essential public health services, but these, of course, are more focused on the role of law and policy and are necessary for promoting, enacting, and carrying out effective health policy for all. So one thing that I think is important to note is, while many of these services directly involve legal experts and the use of legal expertise, these are not activities that can or should only be carried out by attorneys. These services, much like the work of Legal Epi itself, are transdisciplinary and really rely on the expertise of researchers, advocates, policymakers, and community leaders and organizers alike. So I want to walk through these in brief, just so that you have an idea of the types of services or activities that health departments are involved in and are regularly doing on a day-to-day basis. So first, we have access to evidence and expertise, which is the ability to first identify the problem itself, right? And also its relationship to policy, how policy can be a solution, how it may be an existing barrier, and also accessing the scientific evidence that supports policy solutions. So this includes things like scanning through literature, but also understanding community perspectives, understanding what types of policy approaches already exist in other jurisdictions, and understanding the impacts that they have. So thinking policy surveillance and that information, how it can be useful in understanding what policy options might exist or what hasn't been explored yet. And then we have designing legal solutions, which is the process of developing the policy itself, thinking about implementation and also evaluation of that policy once it's in effect. What does that process look like? Who's involved in that process? Then we have engaging community and building political will, which involves not only reaching policymakers, but also thinking about how to center communities in gaining support and also building coalitions for policy implementation. So who is at that table when it comes to policy decision making? Next is enforcing and defending legal solutions. So what good is a policy without mechanisms to ensure that it's actually being carried out effectively so that we can ensure the desired outcomes? So lawyers, public health practitioners, and policymakers should all be engaged in ensuring enforcement is well laid out, that it's sustainable, and that potential legal implications or challenges are considered along the way. So if you've been thinking about a particular policy solution, but you're seeing in other cities or states that it's been challenged, how might that play out in your jurisdiction, and being prepared for that possibility. And then finally, we have monitoring and evaluating policy through rigorous means. So legal epidemiology, right? The scientific methods, applying scientific methods to understand the impact of policy on health. So in recognizing that lots of folks, and especially those at health departments or those who are working closely with health departments, are carrying out these services on a regular basis, we really wanted to, with this capacity building effort, think about how we at Temple, through this capacity building effort, can support the use of Legal Epi to carry out these services. Next slide, please. So our goals here were to both enhance the use of Legal Epi in the public health workforce, but to also shape the development of a legal epidemiology resource center to provide an open access web-based center to provide tools and resources to strengthen competencies within health departments. So not only are we developing this community of practice, but we are also working on creating resources that will support the work of members of this community and beyond. And so to do that, we wanted to gain insights from those who would eventually join the community of practice to get a better understanding of what their needs or interests are. Next slide. Oh, perfect. So we held a series of listening sessions to identify and prioritize policy and programmatic needs and goals to guide those capacity building efforts, and to also get a better understanding of what that legal epidemiology resource center should look like. So we hosted this summer 4 sessions via Zoom, and we also had a couple of pre-conference sessions which were designed to, again, identify those needs, gaps, barriers, and also opportunities to leveraging Legal Epi. We identified potential community of practice members by looking to our own directories, folks who we've worked with, those in the field that we know have familiarity with the 5 essential public health law services or Legal Epi generally, and invited them to attend one of these listening sessions. These were structured in a way that were designed to really foster a conversation. So we had survey questions, polling questions, but really we just wanted to hear from participants what their experiences were with Legal Epi and the challenges that they face and the things that they might need from us to help them leverage Legal Epi in their own work. And the 2 pre-conference workshop sessions we held were at this year's Council of State and Territorial Epidemiologists annual conference, as well as the NACHO 360 conference this year. I think we had a total of nearly 90 participants across all 6 of those sessions. So we had a lot of great participation and feedback. We asked a lot of questions, so I won't list them all out, but just to give you an idea of what we were sort of asking the group was really just about their existing capacity to do Legal Epi. what does that team, if there is one at their department, look like? Do they have a dedicated policy team? What types of things are they working on? Have those teams or individuals had opportunities to attend a legal epi or public health law training? We also asked about what types of current policy or legal issues they're working on, they're interested in working on. We also wanted to know what, like I mentioned, would be effective for that online resource. So we asked about tools that they currently are using, whether that be one that we offer at Temple or other resources. What are the formats that are effective for them? And for the community of practice, what would be an effective way for actually sustaining that community over time? Would that look like regular meetings? Would it look like having a listserv, for example? So we asked a lot of different questions of the participants and got a lot of great feedback and distilled that into a few key themes. Next slide, please. So overall, we found that there's definitely a need to improve staffing capacity, training, and expertise related to legal epi. Also, flexibility with funding support to implement legal epi methods, challenges with overcoming communication or collaboration barriers, and a need for various modes of training delivery. So with this feedback, we really gained a lot of insight through the attendees. First, legal epi work is not a one-size-fits-all approach. So we learned that across health departments, state, territorial, tribal, local, there's a lot of differences in the communities that are being served, in the department size and staffing and funding, and also the governmental department structures. With that comes challenges with navigating current and evolving political landscapes, whether that be at the local, state, or federal levels. And then we also talked about a need for gaining more understanding or clarity on public health, legal authority, responsibility, how the role of something like preemption might impact a particular policy approach or policy decision making. Bridging the gaps, really thinking about making legal epi tools and skills more accessible, and also making the case for legal epi within leadership. We heard a lot of feedback from folks who are interested in doing legal epi themselves, but maybe higher ups in their department aren't necessarily on board, perhaps because they simply don't know what legal epi actually is. So how to make the case within a department or within their existing structures, why legal epi is an effective tool in the first place. Next slide, please. And we also talked about navigating resource constraints. So adapting the methods to fit needs and capacity. We recognize that while we teach legal epi and policy surveillance methods in a particular way, resources to do that work aren't always available. So how can those be adapted for the needs of the work folks are doing? So thinking about adjusting who's actually working on the research or coding for a particular research project, for example. So can you incorporate something like crowdsourcing or train the trainer method so that you have an internal expert on legal epi who can teach others in the department how to do it? Also adjusting things like scoping or quality control efforts. What is your actual goal with creating policy data or doing law or policy research? Do you want to do evaluation? And what might that look like? And then developing partnerships and collaboration. So we also talked about the communities that are needed to do this kind of work. Who needs to be engaged, like we talked about, making the case within your health department, how to sort of develop that collaboration internally, sharing examples, tools, and processes across departments. So not only working with folks within your department, but working across other departments who might be similarly situated, who are working on a similar policy issue. There's a lot that can be learned from each other. And so with the community of practice, we really hope to foster that learning. And thinking about who else in your community might be interested in doing this work. We at Temple work with a lot of graduate and law students who are really interested in legal epi. How might students who are interested in perhaps an internship at a health department be able to support this work? So really being creative and thinking about how to overcome a lot of those existing barriers. these are just a few of the key takeaways and findings from these initial listening sessions. And we are looking forward to continuing this effort to facilitate the community of practice, which will hopefully be something that sustains itself with leadership from those who are members of this community. So if you're interested in joining, we would love to have you on board. You can scan this QR code to be a member of the community of practice. Although these listening sessions primarily focused on folks who are at health departments or who have had a health department background, this by no means is exclusive to those folks. So if you're interested in joining and learning more about Legal Epi and from this community, please sign up. And if you have any questions, please also reach out. I don't think I shared my contact slide, but I'll send it in the chat. So thank you. And I'll pass it over to Ellen.
Thanks, Ellen. You can go ahead as well.
Thank you. Hi. I'm part of the effort that the Center for Public Health Law Research is making to bridge disciplines and build a community of practice. So I'm going to talk about the process that we went through at the University of Texas School of Public Health to create a certificate in public health law research and policy surveillance. And yeah, can we go to the first slide, please? First of all, I wanted to say that there's been a lot of activity in law schools looking at legal epidemiology and developing it and teaching public health principles to lawyers. The same has not been true in schools of public health. I've been at the School of Public Health in Houston for 14 years and discovered that in talking with other faculty and students, the concept of a scientific approach to law was just mind-blowingly alien to most of them. So I did all my training at the Center for Public Health Law Research, and I've been working to develop ways to train public health professionals in a manner comparable to how law schools train law students. But what are the things that public health professionals need to know about law? About 6 years ago, Change Lab Solutions with CDC funding did a survey of all the schools of public health in the US and discovered that only 13 MPH programs even offered a single public health law course, and only 3 required it for their master's in public health. They've been doing great work along with the CDC and Temple at sort of publicizing this fact over the last 6 years. And so there's now a fair bit more effort in schools of public health to introduce students to public health law. In public health, there is a growing recognition within the last few years that law actually defines the boundaries of public health activities and that laws, regulations are non-medical drivers of health, which is the non-medical drivers of health is the language that my School of Public Health now uses instead of social determinants of health. One of the barriers to schools of public health increasing training in public health law research is that every School of Public Health has to meet the accreditation requirements of the Council on Education for Public Health. The acronym is pronounced CEF. They had taken out all requirements for law in their curriculum several iterations ago. So that means that very few public health programs teach public health law or legal epidemiology. They are currently revising that with this new interest in public health, in what policy is and how it can be incorporated in the curriculum. So the CEF is currently holding public comment until January 9th, 2026 on what the new criteria should be for public health curriculum. The competencies that CEF outlines for professionals in public health are entirely in the language of policy, usually treating policy as a program, not as something that might be a federal or state or regional law. So the 4 competencies are: discuss multiple dimensions of the policymaking process, including the roles of ethics and evidence, propose strategy to identify stakeholders and build coalitions and partnerships for influencing public health outcomes, advocate for political, social, and economic policies and programs that will improve health in diverse populations, and evaluate policies for their impact on public health and health equity. So only the fourth is the one that looks at how do we actually evaluate this, the role of law in public health. Can we have the next slide, please? So to figure out how to put together a program teaching the legal concepts, we went through steps of defining the gap in skills and knowledge between what we were currently teaching our students, both in master's and doctoral level programs across all disciplines, across the whole school, and figuring out what the gap was that we needed to address. One of the things that's a key gap is understanding of causation, because the legal concept of causation and the public health concept of causation are entirely different. So that was one of the first things that struck me. Can we go to the next slide? What we started with was the CDC competency models that were published in 2005, I think, that was divided into 3 sections: public health law as the foundation of governmental public health practice and tools to advance the public's health. That is what's most often taught in schools of public health, is here is how the government works, here is how it affects public health, here's what you're allowed to do as a public health professional. The second competency is legal epidemiology, which is public health law research using objective, standardized, reproducible methodologies, that everything that Kaysen discussed about the transparency and standards for documenting what your research is, what the intervention is, considering law as an intervention, and measuring that in a way that's reproducible and transparent. We considered including public health emergency law, but decided not to include that in our first stab at our certificate, because the public health law and the legal epidemiology competency models both deal with the standard law, and public health emergency law is, here are all the exceptions in a declared emergency. So we focused first on teaching public health law as the background for what people need to know about how law works, and then legal epidemiology, what are the methods you need to measure and use the data about law as an independent variable in a causal analysis of law affecting health outputs. And we figured that we would add public health emergency law later. Can we have the next slide, please? So we went from mapping from those models, we took public health law and legal epidemiology, which in the CDC models are divided into 3 levels, one being the entry-level position, and we figured that would be the equivalent to what needed to be taught in a certificate. A medium, sort of middle management level are the knowledge and skills that are needed for somebody with a master's in public health. And then the executive level of knowledge and skills that one would need to learn in a DRPH or a PhD to function at the executive level in public health law and legal epidemiology. So we looked at the components of those 2 models, and then we mapped them to the departments that currently teach courses all the way across our full curriculum, and figured that we needed to include legal issues in healthcare and public health law, and then qualitative research methods, which is taught in the Health Promotion and Behavioral Sciences department, but is not taught to use data on laws to do the analyses, and that we needed people to have a good quantitative and qualitative research methods from having taken biostatistics and epidemiology. Can we go to the next slide, please? Then we looked at all the various concepts that law students learn in their first year of law school and looked to see if we actually managed to teach any of those to our public health students. If you think about what it is that law students learn in their first year or first year and a half before they ever take a health law or public health law course, they have typically studied constitutional law, civil procedure, torts, property, contracts, criminal law, statutory interpretation and regulations, and usually in their second year, they take administrative law. So there are a lot of concepts there that students who've gone through the first year or year and a half of law school have under their belts before they ever learn about legal epidemiology and how to measure laws as a factor in creating or causing health outcomes. And we divided into these categories of administrative law, judicial decisions, torts, and executive power, and then figured, okay, we need to make sure that our students learn all of these by the time they've gone through a certificate with us. So can you go to the next slide? We had one existing course, which is legal issues in healthcare. And then to teach the rest of those concepts, we needed to create 3 new courses. And so we did create 3 new courses by grouping the learning objectives that fed into the CDC models. And we ended up with law and policy, which is basically an administrative law course that looks at jurisdiction, authority, and power. You know, who does what and how does the government work? That's been really exciting to teach in the last couple of years. It's much easier to teach the more independent standing courses, research methods in public health law, which draws on all of the different disciplines that look at the connection between inputs and outputs and looks at the theory of change in either individual behaviors or institutional behaviors. And then the legal epidemiology and policy surveillance course is the one where we teach the all of the best practices that Kaysen was talking about in finding laws, recording laws, codifying the elements of those laws into a data set that can be used. Can you go on to the next slide, please? Okay, so we also figured that additional training is needed for legal issue spotting, understanding and interpreting changes in authority and power, figuring out how to frame public health questions in legal terms so that you can actually state the question and the hypothesis for a public health law question in a way that matches up with how you are collecting legal information and codifying it. It turns out that people in public health think, oh, if there's a law, it's all in one place. That is the part that the very first thing that my students have a hard time understanding is that all of the relevant parts of a law will not all be in one place. And it takes work and thought and iterative work to figure out where all the parts of a law that regulate or impact public health are to be found. And they also need to learn enough of the language that they can collaborate effectively with lawyers, because this is a team sport. There is no way for this all to be done by any one person, one group. So that's how we ended up with a certificate. I'm now working on some curriculum for a higher level. That's just at the beginning stages, but aiming at the executive level. And let me look at this question here. funding mechanisms.
All right. Thank you for that. And what we will do is turn to questions now. So if all the presenters could come back on, that would be great. And Ellen, I think you were about to begin answering the question. So if you want to take the question, and I'll read it out for those in attendance. When institutions begin developing legal epi training for MPH and doctoral students, what are the practical steps for designing the curriculum? And what funding mechanisms, internal or external, are most realistic for supporting this work? Finally, how do programs typically secure sustainable funding to support course development and faculty time?
That is a problem. I am instructional faculty, which means I have no research funding at all. I am entirely state funded. I got some support from the dean's office, from the dean's discretionary funds to support part of my time to help develop the program, because my dean got very interested in policy and was stunned to hear me talk about law in terms that were statistical. You know, the fact that I mentioned a multivariate regression analysis as something one might do with legal data, he found mind-blowing and exciting. So he actually supported me for a year, part-time for a year, to help develop this program. In terms of ongoing sustainability, I had to do a business plan that showed how many students I would need to register for each course to pay for my time as a faculty member to justify introducing a new curriculum. And the curriculum had to go through 5 layers of review and approval through the School of Public Health, because we had to map it to CEIF competencies, and we had to get the curriculum committees for each department to review it and approve it, especially epidemiology, who, when I first referred to this as legal epidemiology, because what we're looking at is the distribution of risk and risk mitigation. They looked at it and said, "You're not teaching epidemiology, and you're certainly not teaching it to our standards." Mm-hmm. And I said, you know, I didn't make up the name. This is what people in law all refer to it as, because it is evocative of something very particular. It's been in use by the CDC and the people who've development and all the nonprofits and funding institutions. They said, that doesn't matter, you're not teaching epidemiology. So that's why I specifically refer to public health law, research, and policy surveillance. And that is the title of our certificate. That will be a problem. You know, sort of the ownership of particular keywords will continue to be something that is a hot topic between disciplines.
Mm-hmm. All right. Well, thank you for that. Kason, I wanted to ask you a question, just building on your presentation about asking people to join the process under Stellar. Could you say a little bit more about that?
Sure. So the Equator process has a number of steps to develop a formal reporting standard. Where we are right now in that process is trying to plan for what is called a Delphi study. A Delphi study takes a panel of experts and iteratively asks them for feedback on certain questions. In this situation, we'd be asking them what they think should be included in a reporting standard. What's neat about a Delphi study is, because it's an iterative survey, the experts get to see how other experts in the field are responding to the same questions. So they get to learn and respond from each other with each iteration. The idea is that we are sort of driving towards a consensus on certain items and identifying those other items that aren't in that consensus. That's where we are. And when we, I think very soon, we're going to start recruiting for our expert panel in that process. Now, after that, we get the results from that Delphi. We are going to be holding a hopefully face-to-face convening, not just of the experts in the Delphi panel, but of the broader community to look at how they responded and see whether or not we can finalize a list of guidelines for reporting. So that's where we are in the process. Now, beyond sort of that active engagement, after the standards are developed, we're going to need quite a bit of help to get those standards to catch on in the broader research community. And that means having researchers that actively cite them in their work, having peer reviewers hold authors accountable to them, and getting journals to adopt them as requirements of studies that are conducting these studies. So hopefully that answers your question, but it's an exciting time.
Great. And I'll go ahead with the follow-up question that we received from the audience. You mentioned standards. If they've been drafted, can you share this with the group?
No, they have not been drafted. There are many excellent articles that I've already talked about, various sort of methodological recommendations or best practices. That's not exactly what we're talking about right now. So for example, there was I want to say it was a 2015 study by Presley, from who is with the Temple Center for Public Health Law Research. That was a Delphi study of best practices in legal measurement. But that's not what we're talking about here. The standards themselves are still under development. There is no draft. The soonest we will have a draft will be after the sort of face-to-face meeting, which is after the Delphi. So there's still plenty of time to get involved if you would like to be part of this process.
Great, thank you. And Alex, I wanted to turn to you. You talked about training community to participate in Legal Epi. And I was thinking about could you potentially train members of the community, right? Individuals, community advocacy groups to be able to do this work? I would love to hear what your thoughts are.
Thanks, Rakaya. Yeah, that's a great question and reminds me of something that I left out from my presentation, which is also that in addition to the community practice and also the online resource that we're building from those who join the community practice, we are hoping to work with them more closely to support a particular Legal Epi project, public health law project related to the 5 essential public health law services. And we have a laundry list of ideas for what that could look like. One of those potentially being trainings for community members or thinking about using ideas from work that we've done recently, how to center community as a part of the Legal Epi process and what that could potentially look like. So I definitely think that's a possibility for sure.
And I'm excited about that because that goes into what Ellen was kind of talking about training people to define and come up with a hypothesis for coding. And I think community could be a welcome part of that. In terms of designing projects, asking what policies are we going to even study? What have they meant? And being able to use that hypothesis in the Legal Epi. I want to go back to you, Ellen, because the first question was so detailed. I want to come back and just follow up on one of the things that you said, particularly around how to connect some of this terminology from epidemiology, right? When you think about epidemiology from the public health side, it's different from the legal side. And you had started to talk about that. I want to give you an opportunity to expand on your answer and to even talk about whether you think we can connect those two sort of fields to use that word, that same word.
I'm not sure whether we'll manage to get to legal epidemiology as the one term that everybody agrees on. But certainly in terms of the vocabulary that lawyers or law students learn and use with ease to represent various ideas, and the ideas and vocabulary that public health professionals, students learn and use. I think one of the things that I'm most excited about is that I'm partnering with the University of Houston Law Center, sort of informally mentoring a new faculty member they hired to teach their law students legal epidemiology during the same semester that I'm teaching my public health students legal epidemiology. It's complicated to get sort of official collaboration between the two schools because our semesters work differently, our scheduling of courses work differently. But we're talking about pairing up our public health and our law students to work on the same research question. And I've been soliciting faculty from around the School of Public Health for good questions to use as training questions for the students. And so we're working on that right now in the hopes that we can do this informal pairing of our students and some crossover guest lecturing in each other's courses. And I think sometimes the informal matching people up may be a good way to start to create the community of practice and the connections, which then once we already have it going, then we can convince the institutions to formalize it a little bit more.
Well, thank you. I want to thank Hasten, Ellen, and Alex for their presentations, and to everybody else for participating and joining the webinar. We look forward to seeing you next year. And I am so thankful to be joining the center and look forward to participating in more of these. So thank you, everyone.